This model I like to call the flat face model. There are a number of different things that we can see on this model. What we have here going around the cerebrum is the superior sagittal sinus. Of course, this is the cerebrum. The bumps are gyri, single gyrus. The depression would be sulcus, plural would be sulci. You see the corpus callosum coming around here. This almond-shaped structure is your thalamus with the interthalamic adhesion. Below that we have the hypothalamus. It's hanging off the hypothalamus, sitting in the sella turcica is our pituitary gland. We look on the back side, we see our little pineal gland. Below the pineal gland we see two little bumps. Those are our superior and inferior colliculus. From the well, let's go back to this. This space in here, this is supposed to represent the space of the lateral ventricle. So we have one on each side, our first and second ventricle. The space over this would be our third ventricle. Then following down here, we have the cerebral aqueduct going into our fourth ventricle. Here we have the region of the midbrain. This has our cerebral aqueduct and our corpora quadrigemina. Here we have the pons, medulla oblongata, spinal cord continuing down. This is our cerebellum. I would not ask this structure here. I'm not certain if this represents the straight sinus or the transverse sinus because it's a two-dimensional model as opposed to a three-dimensional model. I can't tell if it's going straight or if it's supposed to be coming out in this direction. So I would not ask that one. You can see some sinuses over here. The frontal sinus, ethmoid sinus, sphenoid sinus. We see our superior, middle, and inferior nasal concha. The superior and middle being part of our ethmoid bone and the inferior nasal concha being its own bone. We have a region in the back here called the pharynx. From this whole area is the pharynx. Specifically behind the nose we have the nasopharynx. Behind the mouth, the oropharynx, and in the back here, the laryngopharynx. You can see some cartilage. This is the cartilage in the light blue of the epiglottis. In front here, we have the thyroid cartilage. Below it here, we have the cricoid cartilage. You can see in the larynx here, this tube, we have two folds. This is the false and true vocal folds. Over here, this is part of the bone of the mandible. We can see these muscle fibers going from medial to lateral. This is mylohyoid. This one here, going from anterior to posterior, is geniohyoid. We'll see those later when we talk about suprahyoid and infrahyoid muscles on the cadaver. This model I like to call the ugly face model. It's a face that only a mother or an anatomist could love. But we can still use it to see different structures. Going around the eye, this very beautifully shows the Orbicularis Oculi. Going around the lips, the Orbicularis Oris. These are both muscles of facial expression. From the corner or angle of the mouth going down, this triangular muscle here is our depressor anguli oris. And then this muscle with the fibers going in the opposite direction will be our depressor labii inferioris. If we go over here, this large muscle here is masseter. This is our parotid duct gland with the parotid duct going into our buccinator muscle. On this side we have, going up to the zygomatic bone, zygomaticus. Let's see, on the front we have frontalis, temporalis, in the back occipitalis. Between frontalis and occipitalis we have the aponeurosis, the fronto-occipital aponeurosis. Coming down here we can see sternocleidomastoid, named for its origins on the sternum and clavicle and going into the mastoid process. External to that we see our external jugular vein, which drains the face. And then deep to that, we see our internal jugular vein that drains the brain. Next to that, we see our common carotid artery. We cannot see the bifurcation of a common carotid artery, but the common carotid artery is going to divide into our external, which supplies the face, and our internal, which will supply the brain. We do see branches of the facial artery and facial vein here on the model. I will make one quick comment on the muscles that we see in this region. Muscles of facial expression, such as Orbicularis Oris and Orbicularis Oculi and buccinator, are innervated by facial nerve 7. Muscles of mastication, which include masseter and temporalis, are innervated by cranial nerve 5 sub 3, the mandibular branch of trigeminal. Sternocleidomastoid is innervated by cranial nerve 11. So do definitely go back and review your muscles, because you will find different innervations. I'm going to turn this upside down for a moment to look under the jaw. We can see another gland here, our submandibular gland. We have a muscle here in the front. This is the anterior belly of digastric, which goes around. This is a continuation. That's the posterior belly of digastric. This muscle has 2 different innervations. Anterior belly of digastric is innervated by a branch of 5 sub 3 trigeminal nerve, and posterior belly of digastric is innervated by facial nerve 7. Also, we see this muscle. This is stylohyoid, which is also innervated by facial nerve 7, cranial nerve 7, which is facial. Did I mention this is the submandibular gland? If I did mention it, I'm going to mention it again. We have 2 identifiable infrahyoid muscles here, this being the hyoid bone, so the muscles above it would be suprahyoid, the muscles below it would be infrahyoid. The one that is most medial, that goes from sternum to hyoid, is sternohyoid. The one next to it on the same level, that goes from the hyoid bone down to from the shoulder to the hyoid bone, is omohyoid. We do not see the 2 other infrahyoid muscles on this model. Okay, so I think for this class, these are the most recognizable structures on the ugly face model.